Welcome to the Dignitary Friends. So today's topic is mainly about the basic principles of homeopathy and the soul part of a homeopathy that is about miasms and the constitutional drugs. So why it is important for us to understand the basic principles of homeopathy for the vibronic practitioners is here, the vibronics is mainly based on the homeopathic principles of the law of similars. Uh, Excuse me. There's a ban ಮಾಡ್ರಿ ನನಗೆ ಡಿಸ್ಟರ್ಬ್ ಆಗ್ತದೆ ಅದನ್ನ ಹಂಗ್ ಮಾಡಿದ್ರೆ Sorry for the inconvenience. Yeah, hello, welcome you all again. So today we'll be dealing the basic parts of the homeopathy, mainly the we can say the soul part of the homeopathy regarding the miasms and the constitutional approach of homeopathy. So why it is important for us is like vibronics is mainly based on the law of similars of homeopathy. So as to get know the depth of the vibronics, if we have the basic ideas of a homeopathy, so that we can apply the uh, rates according to the need in a very proper manner. So here today I have made it in a very simplified form. By taking the group of authors. So I'll be guiding this, the basic part just in the form of stories, like so that it can be memorized easily. So we all know the founder of homeopathy is Master Hahnemann. So Master Hahnemann was a allopathic himself. Like after practicing so many years of allopathy, and after studying the deeply the after effects of the allopathy for constantly around 10 years, he comes to know that instead of doing the justice, he is committing the sin. Instead of removing the disease from the patients, he is adding without the knowledge of the patients, very in a silent form, he is adding many more diseases to the patients. So later, after the continuous and long studies about these case records of 10 years, he realizes like whatever he is doing is the sin. So as the like patients comes to us treating us as a god, but what we were doing is like just committing the sin. So that is the reason like Hahnemann decides to leave the allopathic field completely, and he starts for his bread and butter. He starts translating the books from. He is a master of 7 languages, so he starts translating from German to French, French to English. In this manner, for his bread and butter, and for the depth of the knowing the learning the science, he starts this translating the medical books from one language to other. So while translating, he strikes one fine day. He strikes with the concept of similia similibus curator. That means like cures like. Here, like cures like means, for example, like for the all the snake venom. So when we get the bite of the snakes, we have the drugs here which are prepared from the snake itself, that is NASA, lycosis, these things. So here what we do is the same snake poison, we dynamize it, we potentize and dynamize it in a finer form, so that this the higher dynamic force that will permanently remove the lower crude nature of our disease. So in this way, he developed the law of similia. Further, as he goes on studying the depth of the nature's law, he classifies the diseases into mainly three categories. One is the diseases created by the artificial, like he calls it as artificial diseases, or these artificial diseases are the one which are created by the after effects of the allopathic drugs or any other crude materials. Uh, and the second thing is indisposition. Indisposition means these are the temporary diseases. For example, with or without medications, these diseases they subsides themselves. For example, food poisoning. So, on food poisoning with the vomitings and the loose motions or pain abdomen, if we take a sufficient rest along with the if we keep under fasting, we may be all right without the medication. Similarly, few other maybe headache or because of the climatic changes or any hay fevers, all these things. So which because of the temporary changes in the environment or our food style or the lack of the sleep, these things like when we produce symptoms because of the improper lifestyles and the changes in the atmosphere, all these things. So these symptoms may remain temporary and they may subside without treatment. These all comes under the classification of indisposition. And next, the final and the most important part of the disease is a chronic disease. So Hahnemann, in his continuous the hard work of our 10 years, so he has seen the many diseases which he keeps giving or to say he has treated according to the law of similia itself, but still the patients gets a temporary relief, and again the patients will be after certain months again the patients will be coming with the same symptoms. So the diseases which are coming again and again, so yeah, that makes him to go for the depth of the science. So here, finally, after studying in depth, he comes to a conclusion. There is a pollution, or there is a basic fault which is responsible for the chronic diseases. So this the causative factor, he calls it as the miasms. Miasm is a Greek word. Here, miasm means is a pollution or to say fault. So this the Hahnemann contributes all the chronic diseases to be a part of the miasms. Uh, so before starting the chapter of miasms, just we will go for the little basics how the theory of evolution of the diseases started as per our master Hahnemann. So this theory of diseases, it date backs to the age where the Noah's flood. So all of you must have heard of Noah's flood. So in the Noah's flood, when the sin increases, as per the Hahnemann, like when the sin increases to a level, to say to the top level. So what happens is the nature starts deciding to wash away the sin in its own way. So that is how the nature. So when the sin increased to the highest, the Noah's flood occurs. So in the Noah's flood, So it gets washed away to the larger extent. So the little part has remained, a little part of the humanity remained. So those human beings who survived in the Noah's flood have still, like, it's not like a very purified form. Still, they were having the uh, uh, so-called, like, pollution or in their mind, not so pure. So that the remaining part, he compares it to the Sora, like, he calls the remaining smaller population who have survived in the Noah's flood. He finds, like, those the majority of that population is suffering from the skin diseases in a larger form. So this is especially the skin disease that he contributes it as a Sora. So there are mainly three basic miasms according to Hahnemann, that is Sora, psychosis, and syphilis. So Sora is he calls the Sora as the mother of all the diseases. So to say everyone, every man is not apart from Sora. Sora is there in all the persons. He contributes Sora as the mother of all the diseases. So Sora means basically he refers it to as a skin itch. Skin itch. So this or can say any form of the, like, all the skin disorders. So here the Sora is the base form, or can be said the mother of all the diseases. So almost the 90% of the diseases that contributes to the Sora are in other words, we can say Sora is the mother of all the diseases. So next comes the psychosis, and next of psychosis is syphilis. So we will go one by one, basically, and again how these are helpful in our for the vibranic practitioners, in what way they are going to help. I'll elaborate in after the brief session of these miasms. So coming back to the Sora, Sora is the mother of all the diseases. So this here, like, when we take the, for example, like, for example, take a person who is a category of scientist who is very intellectual, with a high memory, highly social, and generous. These all the persons, they come into Sora. So just by taking one person, we will go to the elaborative form, how he from Sora he turns to psychotic, and from psychotic to syphilis, like that. How the stages from Sora stage, from next to Sora, psychosis stage comes, and the next to psychosis, the syphilis stage. How a person from the base, he as the degeneration goes on, how he keeps entering into different stages. So here the coming to the basic mindset of Sora is all the Soric persons will be very social, highly generous, they are highly intellectual with a sharp memory, and all everything in a very hurry and very manners, and they will be oversensitive to pain, and over highly emotional. So, for example, like all the categories of scientists belong to this soric nature. So, as for example, when the scientist he discovers something, so what happens in the next stage? So here, what happens the next stage is, like, a few of these scientists, they wants to hide everything in a, like, a secretive manner. They wants to keep it away from the society. for their own benefit. So they, as a person, they starts becoming, once they achieve something, they start becoming greedy, and they starts accumulation, like psychosis can be called as a accumulation in other words. So they keep accumulating everything in a secretive way. They starts getting isolated from the society. So all the three S contributes to the psychosis, basically, like self-concerned, selfishness, and secrecy maintaining. All these three S we can broadly like explain in these terms. Uh, so the next stage, the mild stage of the psychosis is, so very like a fixed principles, like what he is right in everything, so everyone has to obey him, with the fixed natures, and hiding everything, maintaining secrecy, getting isolated from the society, becoming more and more greedy for the money and the material things. So these all are the mentality of the psychosis. And next is the syphilis. So what happens here? Like how long he can keep accumulating and keep isolating from the society. So as the ages pass on and pass on, so what happens finally is he starts getting old. Everything starts getting degenerated. Like even the what he can do with the accumulated wealth or the material things, like so one find when he like completely gets isolated from the society, and with a very limited friends and everything in a closed manner. So obviously that starts helping, that starts deteriorating him, like where he finally starts finding himself as a scared, like he starts getting after one fine stage, he starts getting panicky, like a great fear starts within himself, like fear for everything, then lack of help, then this all the like and anything is nothing is satisfactory to him. So this way, mentally, with his own well, when he starts remaining for the long, so these all the so-called the narrow-mindedness. These comes in the psychotic group. So finally, what happens? Like when the age passes after certain long years, what happens? Obviously, like when he's isolated and everything covered up, so obviously he starts regretting for that. When his bodily structures all starts getting hypertrophy, and the degeneration starts in him, and slowly what happens is he starts regretting for everything. So no, I have committed a sin, like I have gone into a wrong principle, like I have committed sin. uh, God is going to punish me definitely. So these kind of a loathing, weeping, severe depressions, helplessness, all these things, they contribute to the syphilitic miasm. This is the end miasm as per the Hahnemann. So over the period of years, like so chronic depression, finally that ending into the illusions, hallucinations, and forgetfulness, the lack of memory, then regretting, and weeping, and feeling very very lonely, and at the same time, like as he has committed a sin, and God is not going to save him anymore. So this sort of mentality that contributes to the syphilis. Again, like these are the mental concepts of sora, psychosis, and syphilis. So when like coming to the bodily changes, how the bodily changes keeps changing according to our mindset. Like, so when he was in a Sora, when he was a beautiful person with a generosity, social, intellectual, with a high memory, these all the things. Obviously, his body was cooperating for everything, with the except for the very basic inflammatory changes, like all the basic inflammatory changes. Inflammation, again, I'd like to differentiate what is just like sora, psychosis, and syphilis. We have when we go to the pathologic section of any diseases, like diseases will be in the form of four stages. All the diseases, like the first stage is inflammatory stage. Inflammatory stages, all the itis, for example, like tonsillitis, adenitis, or the metritis, peritonitis. So all these itis means that is inflammation. Inflammation means, in the common word, it is a swelling, or can say the redness of the skin, with a little burning and the heat producing. The beginning part of the disease we call as the inflammatory signs. So all those, the beginning part of the diseases, they all contributes to the psoric miasm, where there is a just the redness, mild swelling of the skin, or to say the inner organs, with a little heat and pain, burning sort of pain, or a tingling, or any sort of along with the pains. So the next stage is the congestion. Congestion is a stage where, after the what happens, like any organ, to say the skin, after getting redness and after producing heat with certain pain, the next step is we can see the slight swelling over that part, or I can say that that organ starts bulging a little. That is and at the same time, what happens is blood starts congesting there. So this is called as a congestion. After the inflammation, the second stage of the disease is a congestion. Um, so here the in congestion, what happens? Slight bulging starts in the next steps, like it is called the hypertrophies. Hyper means increasing. Trophy means size, like increasing the size of the underlying organ, getting enlarged. That is like getting hypertrophied, we call it. Like so these all the hypertrophies, they contribute to the second stage, congestive stage, or when we compare it to the miasms, this contributes to the psychosis here. All sorts of hypertrophies, or the excessive secretion also here. In the second stage, the excessive secretions, for example, the whatever the secretion may be, nasal congestion, or anything, the contributing to the loose motions, diarrheas, all these things, or the enlargement of the heart, enlargement of liver, the enlargement of kidneys. These are the secondary stages. These are called as a hypertrophy. Hyper means increasing. Trophy means size, like increasing in the size of any organs or skin. That contributes to the psychosis here. So all categories of warts, or any moles, warts, all kinds of tumors, these all contributes to the psychosis here. They come under the miasm of psychosis. So next what happens? So once for example, we take the tuberculosis, for example. So in tuberculosis, what happens? So there is the first stage is the inflammatory stage, where the portion of the lung lobe that gets reddish, one starts developing temperature, with a little cough, cold, these things, with the loss of appetite, that contributes to the sora. And next, what happens is that we call it as a consolidation, where that organ starts accumulating, the congestion starts inside, getting a hypertrophied. And the next stage is um, solidification, and next is a liquidification. That is liquidification is the final stage that contributing to the syphilis here. So, or it can be said like inflammatory congestion and destruction also. In this way also we can say the finally the destructive part or the consolidation or the liquefaction when, for example, the abscess, initial form of abscess is how it is. It is the skin is red, the abscess like you can see the severe pain with redness, heat. Later, what happens in the second stage of abscess? What happens? Pus starts accumulating. So that is the second stage with the bulging, can say swelling. That is the psychotic stage. And when the abscess bursts, like bursts, or it starts getting more the deeper infection, turning to gangrene. We can call necrosis or into gangrene. So that contributes to the syphilis. Syphilis means it is the complete destruction, destructive part. So just like as a mind destruction, the same way here the bodily destructions. So all categories of the reversible diseases. For example, any sorts of like to say gastritis, tonsillitis, laryngitis, peritonitis, uh, all these itis groups like where there is a just inflammatory changes, they are the psoric categories. They can be easily reversed with a proper treatment. And the psychotic changes where there is a growth, warts, corns, tumors, enlargement or accumulation of water inside, ascites. These the secondary stages of all the diseases contribute to the psychosis. Psychosis can also be reversed with the proper drugs. Next is a syphilis. Syphilis where there is a complete destruction. For example, there is the necrosis, all categories of necrosis, all the gangrenes, and how to say like all the bony destructions, all the or the degenerations, complete loss of elasticities, the destructions of bones. These all these the end products of the diseases. These all contributes to the syphilis. Uh, so next, coming to the from the head to foot, like just we will go on briefly explaining how the psoriasis psychosis differs in the symptoms. Like so, when from the top of our body, just coming to the scalp and hairs, like so, Sora, in other words, like Dr. Robert calls these miasms, for the Sora, he calls as a deficiency, or can be said dryness or deficiency. And for the psychosis, he calls as a excess, and for the syphilis, he calls as a destruction. So in this way also it can be treated. For example, like when we take the scalp and hairs, like the excessive dryness of the scalp that leads to dandruff. So the dandruff comes into psoriasis. So the main drugs of psora, the king of psora is sulfur and sorinum. So almost like 90% of these the diseases can be cured with the drugs. The king of the Sora, that is sulfur. Sulfur is the main drug for Sora. So if you don't get the proper drug, like likewise we have for Sora there is more than 100-150 drugs. Similarly for psychosis we have more than 100 to 150 drugs. Similarly for the syphilis, but the just to memorize and which drug is most important in these cases is, for example, like sulfur. Sulfur we call as the mother for all the diseases. So irrespective, so whenever the patient comes to us, like when we are sure like he is into psoric category purely, So just blindly, when you fail to approach the proper similimum drug, so just you can go for the sulfur. Sulfur itself, definitely it will be covering more than 70 to 80% of all the symptoms of the diseases, and definitely it will help in curing the disease completely over a period of years. As the sora is the mother base of all the diseases. So here the sulfur is the most important drug in homeopathy. So likewise in the psychosis, the king of psychosis is the Tusa drug. So whenever you are like when you make sure like the person is predominantly psychotic category, so when you don't get the similimum drug, and when you fail to differentiate between so many drugs, like just blindly you can go for the Tusa. When you are short, and this is he is purely psychotic, just go for the Tusa. So over the repeated uses of Tusa, just like once a week, in this manner, once a week, followed by once in 15 days, later once in 2 months. In this fashion, any of the chronic psychotic miasm can be completely healed with the Tusa drug. Similarly, in the syphilitic category, like in the syphilis, aurum metallicum is the aurum, first is the aurum metallicum and next is the syphilinum. These are the king of this syphilitic miasm, kings of syphilitic miasm, you can say. So again, the similar way, when you fail to match properly, when you are sure, like here, the patient is syphilitic in nature, basically. So, and you fail to arrive the proper drug, just blindly you can go for the this aurum metallicum or syphilinum. Definitely, that is going to help them for the minimal of 70 to 80%, and they'll be largely improved. So coming back to the miasms again, like from the head to the top, like from the top, like for example, like coming to the scalp and hair. So here the dryness of the scalp over a long period, that results into dandruff. For that, in other terms, we can call it as a sora only, or that is the same thing, the chronic dandruff nature. They we go for the treatment by considering it as a the basic psoriasis itself. So here the sulfur, the what are the symptoms and indications here is dryness, lusterness of the hairs, and hairs falling in a large extent with a severe dandruff. This contributes to SORA. Here, the sulfur can be given mainly. And again, coming to the eyes, the dryness of eyes, or the basic symptoms like as if the sand in the eyes, there is a painful eyes with a little lacrimation, little hay fever like symptoms. These all the comes into SORA again. Again, in the coming to the nose, with the little basic changes like with all the conjunctivitis, all this comes into SORI group. Conjunctivitis, again, this itis means itis is the inflammation. Just there is a mild redness and slight inflammatory swelling of the eyes. This all contributes to the SORA. Again, coming to the nose, the similarly the here the initial symptoms of the cold and cough. This all contributes to the SORA, with the dryness of nose, dryness of throat, all these things, with a little bit secretions. Again, coming to the heart, like so here in the heart, generally in the SORA, we called it as a deficiency. Deficiency means here in the when we come to the heart, like the here the heart functions like a bradycardia. Bradycardia can be counted to the bradycardia means the heartbeats lower than the normal. Uh, to say it's lower than 70, maybe 50 or 60, like that, that contributes to the sora. The same way in the heart, like the excess heartbeat, that is called as a tachycardia. Tachy means increased, brady means decreased, reduced. So here in the heart, the bradycardia that contributes to the sora, whereas the tachycardia contributes to the psychosis, whereas the tachycardia and also the enlargement of the heart muscles, this all contributes to the psychosis. Whereas the when the in cases of myocardial infarctions where there is a shortage of a blood supply to the muscle and the heart muscles, and when the cardiac muscle are in the necrotic stages or the degenerative changes, with that contributes to the syphilis again. So again here in the so in the scalp and hair, like here, like sora can be as we said, sora is the dryness of the scalp with the hair fall, and similarly here the in the psychotic stage, uh, hair fall, like the ringworm, or the hair in excess hair form and the matting of hair together, uh, or sometimes there is like eczemas of the eczema underlying with a little bit of greasiness and a secretion from the scalp. These all contributes to the this or the navies or any warts, polyps developing over the scalp. These all contributes to the psychosis. So similarly, in the eyes and nose, the yellowish greenish discharge, or the second stages we can here contribute in the nose, like the polyps. Often we get the nasal polyp with the nasal blockages. So all categories of this nasal blockage, maybe because of the DNS or the other contributing factors, are resulting into nasal polyps. Polyps means these are the cherry-like masses in the nose. Again, this indicating the tumors growth. Here, growth or hypertrophy. This is purely again the psychosis. So those are helping here somewhere. Again, in the throat, that after the inflammatory stage, there is a exuding, exuding, and then the secretion of some grayish or thick yellowish or green secretions. These all contribute to the little part of the psychosis and a little part of syphilis also. And again, so in the heart, like as we said, coming to the from the neck coming to the heart, again the chest areas. Here chest areas, as already said, like the reduced rate of cardiac pumping, like the bradycardia. Brady means reduced, like bradycardia contributes to the sora, whereas the tachycardia means increased palpitations or increased heart rate, that contributes to the sora, along with the myotrophy, like cardiac enlargements. Uh, that the this contributes to the psychosis. Again, what happens at the end stage in the heart is like congestive cardiac failures. So when the heart muscles get hypertrophied, so as the muscles get hypertrophy with the lack of circulation from the coronary arteries, so the muscles gradually starts losing its functions, uh, uh, getting relaxed. This called as the congestive cardiac failure. So this congestive cardiac failure that contributes to the syphilis again here. So similarly in the lungs also, the basic inflammatory changes of any form of a viral fever, cough, cold, contributing to the bacterial or viral infections is where they can be easily reversed. These contributes to the sora. And the next second are the stages of the where the lung lobes enlarged are getting narrow. These mostly enlarged. This contributes to the with the hypersecretions. This contributes to the psychosis. And when the lung lobes getting started necrosis in the final stage, and in the TB also when they open up, discharging the materials, forming the cavities where the large quantities of bacteria will be coming out. The patients will be exploding the bacteria in a heavy form with the totally liquefaction inside the lobe that turn into necrosis and finally into gangrene. That stage uh, falls into syphilis here. Uh, uh, Drugs like the syphilitic drugs mainly help in this stage. So likewise, coming to the stomach part again, stomach here, the basic gastritis, as already I said, the itis. Gastritis means it is the inflammation of the stomach, a little upset of the stomach because of the lifestyle errors, rich foods, or lack of sleep. So these things that contributes to the SORA, with or without treatment, that can one can be corrected easily. Again, the second stages here, the enlargements or any blockages. The end part of the in most of the patients we see the last part of the stomach, that is the pyloric part, getting the stenosis. Getting the stenosis means narrowing. That is called a pyloric stenosis, where the person feels to uh, there is similarly here in esophagus also food pipe stenosis, and in stomach there is a stenosis, narrowing of this GIT tract, that leading to difficulty in deglutition and blocking the here and there. These all the contributes to the psychosis. Again, any tumors developing in the any here the tumors again, when they are benign in nature, means benign means the initial stages of the tumor, they are harmless and they can be reversed with the proper medications. So all the benign nature of the tumors of the stomach or anywhere in the body, they contributes to the psychosis. And when the tumors turns to cancer or the in a destructive manner, that falls into syphilitic category again. Uh, and similarly, in the GIT tract here, the as I said, as per the Dr. Robert, this syphilis is the deficiency. So means here the constipation. When we take the example of GIT tract, the constipation, sluggishness of the bowel movements, straining with much difficulties, all these piles in a initial form. This all contributes to the psoric miasms. Here, again the sulfur is the main drug, that is the king of Sora. The next stage is here the getting varicosities. Varicosities, like in the piles, what happens is the constant pressure because of the sluggish, the deficient stools, like where the dried stools, with a constant straining for the bowel movements, that produces a pressure over a long period, making the underlying vein to engorge, to dilate on because of the pressure over the veins. So, and when the veins they open up, that leads to piles and protruding downwards because of the constant pressures. So that falls to psychosis again, and the complete distractions again to the one more degree, that falls to syphilis again. So likewise, the coming to the bony sections, like so bones. Uh, Here the temporary the congestive stages of the bone, just like so because of the overwork, exertions, when we have a body ache because of the slight congestion of the blood here there, so that contributes to the sora. On proper rest or with the soric medicines, this can be reversed. And again, the psychosis is the second stage where the where there is a tendinitis, so you must know the tendons. Tendons are they are the just the ribbon hard structures which will be holding our the two or more bones at the joints for the proper mobility. They will be helping in proper mobility. These tendons will be very hard in nature, and the any injuries affecting the tendons leading to tendinitis, to little bit more we, or in other words, say like the periosteum. When we take the bone, there is a the outermost layer of the bone is called as a periosteum. Peri means outer part, most outer part. So the outer layer of inflammation that leading to the severe bony pains, that again contributes to the sora and psychotic nature, with the where there is the inner lying bone medulla will be proper in nature, only the outer layer will be affected. So with the proper the injury drugs like arnica, ruta, hypericum, one will come back to the normal. Whereas when the bone from the inside out, from the medulla cortex, these parts, when they start degenerating, degeneration and into necrosis, then finally into the bony gangrene part, this contributes to the syphilis again here. So syphilis is the complete destruction, where the where it can be maintained further from the further progression. It can't be healed, completely cured. All the syphilitic nature can't be completely cured. It can be maintained further from the further progress. So yeah, I hope the this basic part of all the three miasms will made you the little understandings. So again, after this, the basically during the Hahnemannian time, he classified the miasms into three main, that is sora, psychosis, and syphilis. Later, Dr. Allen, he contributed one more miasm, that is called as the tubercular miasm. So what the Dr. Allen feels is many of the patients coming to us will be having the part of the symptoms of sora, with another part will be, for example, like 50% of the symptoms will be soric, another 50 to 60% of the symptoms will be syphilitic. Like the combination of the large, what Dr. Allen could find is the larger extent of the diseases are in the form of little bit sora, little bit syphilis. So he made one more miasm, the combination of sora and syphilis. He calls it as a tubercular miasm. So we have so many diseases into tubercular classification. Likewise, as the age passes on, as the science starts getting developed, many more other 10 miasms have been added of late. So after the this tubercular miasm, next is the cancer miasm. This cancer miasm means it is the combination of all the four miasms: sora, psychosis, syphilis, and the tubercular miasm. For example, we get a patient where the few symptoms will be soric, few will be psychosis, and few will be syphilitic, in this fashion. So such cases are considered as where all the four miasms are partly involved. those cases are considered as with the cancer miasms. So likewise, the of late by name another stalwart of this generation by name Dr. Rajan Shankaran. He further developed the miasms as malaria miasm, typhoid miasm, ringworm miasm, and a leprosy miasm. So that is how like these miasms as for today, from the going back to the Hahnemannian age, from the three now the miasms are developed into 10 broad classifications. But anyways, like the three miasms are very important for us for the basic understandings. So next coming to the like then how in what way the vibronic practitioners in what way they are helpful to the vibronic practitioners. So here you can see this book. Enlarge. Yes, here I hope this is clear for you all. Like, so this is some series of Natural Healing Volume 1 and 2. So by Swami Narayana and Swami Ananda. This here here from page number 13. They have elaborated the miasms. They have briefed about Sora, then psychosis, and all the three miasms. So, regarding the miasms, you can get in the Narayani Soham series of Natural Healing, Volume 1 and 2. So, you will be getting the brief descriptions of these miasms. Again, there is here one more book. Front page. Yeah, there is. Yeah, I'm. Yes, yes.
Hold a minute. Just.
Yeah, that's fine. So here one more, and when we don't get the proper drugs, blindly we can go for the drugs, syphilinum or aurum metallicum. These are called as the king of syphilinum, like syphilis miasm, like. Minimum of about 60 to 70% of the symptoms will be covered by these drugs.
Okay, thank you, Dr. Suvarna, for explaining about miasm. And okay, sir, we'll decide what means today afternoon. Again, we'll be talking about how to take the case taking, basically regarding the constitution.
Tomorrow, yeah, today afternoon we'll be discussing. Today afternoon session will be the most important one, like where we will be dealing the case history, how to take the case history from the patients, and how the case history is going to help in selecting the drugs, and what is the constitutional drugs like. How they play a major role in treating the disease completely from the root cause. So we will be covering the main and the basic drugs so that we it will be most helpful in the practice.
I already requested you all to have these 7 volumes of the Som Foundation. Most of you already might be having, and I already thought all these 7 volumes will be textbooks for my this vibronic teaching, and we will be covering part of it, and I will send you the WhatsApp number of that Soham Foundation. I can make that PDF and no send to everyone, but it is not. It is a copyrighted thing. So the only way that Soham Foundation can make some funds is by selling books and selling remedy. I don't want to curtail it because it is a mother institute, or you can say mother foundation from where we got this technology. If Soham Foundation was not there, we would have never got this vibronics. Not even me, not even Satya Sai people also. So we should be always to be gratitude, should have a gratitude for the Soham Foundation, and is not so costly also. Within 1,000 rupees you get all the 7 volumes, and then I request you should take it so that everything hereafter we will be discussing will be from the same book. Now today also we saw due to this virtual background we are not able to show it properly, and I will show you how, where and all, which page number we have to follow, so that you can use those books very effectively. And today's constitutional remedies also will be from those books already there in that book, so that we will be covering major remedies from those books only. And also, but with our Dr. Suvarna's her own experience, like she to 2005, she almost 25 years experience she has in the diagnostic and and case taking and other thing. So 25 years experience. She is specialized in liver and kidney treatments. So she will be telling most of the how she is to diagnose and treat with her own way. That will be helpful for us using vibronics. How we can achieve to that to some extent we can, and we'll keep on studying to achieve the level of the professional physician. But our approach will be the Douglas and the vibronics way. And so again we'll meet in the afternoon. We'll talk about the constitutional remedy. I have one beautiful book also. I will show you that by just mere looking at the person, we will be able to diagnose is from what remedy will help him. And we'll also tell the approach of Shankaran for some time, because by just when people start asking me the thing and they start conversation with us, by that itself we will be able to identify what remedy he belongs to. And if possible, we will be taking some Sahagel system also. That's very easy. Very easily we can, the later part of, not today, we will be taking that also, so that by just listening to those words, we will be able to diagnose the things. I will give one example. If someone comes to you with a cough and the joint problem, and then he starts about, Dr. Saab, what's your fees, how much you cost, how much you take, and if you get me, if you make me all right, I will bring 100 patients to you. Then what is this? This is nothing but, as per a cycle system, it is a bryonia. He wants to have a business talks. So they are all there in
Constitutional approach.
Yeah, and the constitutional approach is that is the fantastic one. By just looking at the personality of the person, if and neat and clean and well pressed, that we will be telling in the afternoon today. So but indicate the remedy, and then what you have to do, See, what is the final, you wanted to say something? Yeah, tell me.
ಇಲ್ಲ, ಇಲ್ಲ.
So, see, the remedies, whatever they are telling, the remedies speak themselves out. For example, there are something, when some person, a patient comes to your room and you start arranging the bottles and books we kept in your table. That itself again, that we can say that it is a arsenic alba patient. So likewise, by just their behavior and the way they behave, they look at the place, we'll be able to diagnose them and categorize them into a constitutional remedies. The construction, the basic construction of that, this is decided by the proving itself. Want to say something? Okay.
Well, begin the
Okay, then thank you very much. That our journey will be going to be very great, I just said, and we are going to be at par with a homeopathic doctor. And again and again, will, if possible, today or next time, we will be able to use our repertory and come to a last conclusion of a set of remedies. Then see the miasm, and as per the miasm, again classify those remedies and the potencies to be given, what potency, like that. Complete discussion will be there, and we'll discuss it many times and any times. Not at all to worry. We'll make our prescription should be perfect. We'll make in that way. Thank you very much again, and thank you, Suvarna. Then we'll meet in the afternoon. So I will be giving you some of the PPTs. They are the basic, what are the miasm, and that already whatever you seen that. And this, as it is, this video will be available to you in a recorded form, and it's a very interesting. See, she has, because even she can talk about miasm in weeks together, because that much big topic it is. So you can, I just want to say that birth and the youth and the old age, this also can be classified into the miasm. So young children require soric remedy, and the middle-aged people need the psychotic remedy, and the old age people generally need the syphilitic remedy. So like that, there are so many things like Brahma, Vishnu, Maheshwar also we can compare. Creation and maintenance and the destruction. So it is the energy, but so they have given some name so that so that you can very easily classify and use in a remedial action. Thank you very much. Thank you.
Thank you. Thank you all.
Thank you, madam.